Age-related macular degeneration is one of the leading causes of blindness worldwide. Mostly affecting people ages 50 and older, age-related macular degeneration targets the macula, the central retinal portion that is responsible for sharp, central vision used for things like reading and driving. Age-related macular degeneration, or AMD for short, is caused by variations in the negative regulators of the complement system within retinal cells. Mutation in a gene within the complement system leads to abnormal activation of the complement system. The complement system is a crucial part of the body's immune system that helps defend against pathogens such as bacteria and viruses. It consists of many complex proteins that work together to eradicate intruders within the body. However, abnormal activation of this system within the retina leads to oxidative stress, retinal damage, and ultimately leads to AMD. The base risk of contracting AMD is roughly 14% after age 40 and increases as the person grows older. AMD is most common within developed countries with higher life expectancies. This is because the risk of developing AMD increases exponentially with age. While genetics play a significant role, with 15 to 20% of people who have contracted the disease have a first-degree relative that also has the disease, environmental factors such as cigarette smoking, obesity, low dietary intake of vitamins A, C, and E, and zinc, low dietary intake of lutein and omega-3 fatty acids, and unhealthy cardiovascular lifestyles also have a statistically significant contribution to the contraction of the disease in conjecture with having mutations in the genes that have affected the complement system. Smokers have a 4 times higher likelihood of contracting the disease, and past smokers have a 3 times higher likelihood of contracting the disease in comparison to those who do not smoke. Smoking after the age of 40 years old brings your base risk of contracting AMD from 14% to 56% chance of contracting AMD. To determine if you are at risk for contracting AMD, people will use an SMP chip test to try and detect any single nucleotide polymorphisms, SNPs, within a specific gene that may lead to a mutation that would in turn increase your risk of developing AMD. 23andMe, our main competitor, offers a genetic test that will test for RS10490924, the A69S variant of ARMS2 gene, but more accurately is described as a variant of the CFH gene. The CFH gene codes for one of the negative regulator proteins previously mentioned in the complement system, called the complement H protein. Having an SMP here can impact your protein production of this negative complement system regulator, in turn, increasing your chances of developing AMD. The SMP that 23andMe tests for has the largest impact genetically on your chances of developing AMD. However, our SMP chip test tests for 3 other SNPs that also heavily impact your chances of developing AMD, making our test far superior to those in our competition.
The 23andMe test for AMD checks for the Y402H variant of the CFH gene and the A69S variant in the AMRS2 gene. Both of these variations are linked to AMD, but the more significant variant is the Y402H. The Y402H variant comes about when there's a substitution from histidine to tyrosine. This variant dysregulates the gene's functions. CFH is mostly created in cells found in the liver. The reason why 23andMe tests for these genes does make sense, as variations in this protein are significant to AMD, though it is not a guarantee someone will develop AMD, even if that's variation. The main limitation of the 23andMe test is the lack of variety in testing, as they only focus on 2 variations. There are many other genes that play a factor in whether or not a person develops AMD. Often it is a combination of genetic factors as to whether or not a person develops AMD.
In order for a more accurate test for AMD than that of the 23andMe test, our SNP chip test is looking for 5 variants rather than 2. We still test for the 2 that are tested by 23andMe, however we test for an additional 3 SNPs. One specific SNP we will test for is RS2230199, the GLY102 variant of the C3 gene. This SNP is associated with a much higher risk of developing AMD, with up to 2.5 times the chance. This SNP is a SNP in the C3 gene, an important gene in the function of the complement system, an immune response system which, as mentioned previously in the presentation, helps to recognize and fight foreign pathogens such as viruses or bacteria. The C3 gene in particular produces a protein called complement component 3, or the C3 protein, which has several functions within the complement system, such as opsonization, inflammation, and the direct destruction of pathogens by membrane attack complexes. The article Complement C3 Variant and the Risk of Age-Related Macular Degeneration describes how the C3 SNP RS2230199 is predicted to cause a substitution of a glycine residue for arginine at the position 80. This, in turn, generates the fast electrophoretic allelotype of C3 as opposed to the slow allelotype, which is normally expressed. The fast allelotype caused by the SNP may lead to an unregulated increase in the inflammatory response of C3, which could lead to an overinflammation of the retina, which, in turn, causes AMD.
As of right now, genetic testing for age-related macular degeneration is not recommended by any healthcare organizations. The American Academy of Ophthalmology recommends that all people ages 40 to 54 have an eye exam every 2 to 4 years to detect it early. There is no cure for AMD, so testing positive for the disorder would not provide a better outcome for one's future. But once detected early, there are medications and treatments that have the ability to slow down the progression of it. Getting a genetic test and testing positive may bring people discomfort and make them upset about their future instead of living in the moment. On the other hand, it may give someone a new perspective and outlook on life. They may have something they want to see before AMD sets in. The test on 23andMe costs around $200, which is not too expensive, but is considered unnecessary by physicians around the world.
And although considered medically unnecessary, there are still many reasons to get tested for AMD. And if you do decide to get tested, use our test. Thank you.